Hello, I'm doing my case study on Edith Piaf from the movie La Vie en Rose. My name is Sage Brennan. I'm currently doing addictions family counseling course, pursuing my bachelor's degree in human services with concentration in youth and family studies. A little bit about Edith. Edith was a famous French artist during the 20th century. She was well known for having a life marked by triumph and tragedy. Abandoned as a child, Edith was exposed to various situations that ultimately led her down the path of addiction. Edith's family had a history of alcoholism. She suffered tragic loss throughout her life, and due to severe car accidents, Edith developed an addiction to morphine as well as increased her alcohol intake. Two theories support this case study, one being the medical model theory. This theory supports addiction is beyond the control of the individual, explains addiction on a conscious and unconscious level. It is compared to brain disorders. It increases the dopamine and the adrenaline in the brain, creating addiction. And within Edith's context, her family had a history of alcoholism. The disorder, she was drinking at a very, very early age due to the influences and the surroundings that she had in her life. So there is a good chance that with brain scans, it would have shown changes in her brain, but the medical model doesn't, the brain scans within the medical model wouldn't show alcohol being the cause of the brain change, but it does support the theory. With the behavioral theory, addiction levels are reached by reinforcement. The outcome is to increase pleasure or reduce negative stimuli. Underlining motivations can include attention, avoidance, tangible reward, and sensory simulations, positive or negative. Within Edith's case, with all of the traumatic experiences she had early on in life, drinking would be a form of coping as well as avoiding the negative situations that she was living through at the time, as well as she and her fame grew. Alcohol was able to reinforce the positives of fame and the glamorous lifestyle. So, in a sense, both positive and negative reinforce the addiction. So, an assessment. The best assessment for this specific case study, I believe, was the clinical family addictions assessment interview. It is a powerful tool to understand addictions within the family. It increases the self awareness and relationship insight within the family dynamic, and it supports healthy family changes. It would help assess and diagnose addiction through family discussions, which assessments essentially are here to gather information to make the very best intervention for and diagnosis for Edith. So, experiences before and after the fame would help us consider when the addiction started and how severe the addiction was, what reinforces that she had, what family members may be enabling or trying to help the situation. However, because her and her family came from a low socioeconomic environment, it is safe to say that family members were enablers, mascots, and dependents with the glamorous lifestyle that they had, being that they never had that before. But it wasn't until the fame and the addiction started to grow where loved ones closest to Edith could see the problem a little more clearly. This assessment tool would provide vital information about the addictions within the context of family experiences. So, a large problem that we could see in this case study was the family dynamic in confrontation with Edith when speaking about addiction. Family members were quiet or avoided the conversation. And if they did, it was very subtly because there's a lifestyle that could have been cut off very quickly from Edith, which Edith was a well-known artist that reacted intensely, emotional intensity. She was very demanding by nature. So it wasn't until Edith was physically incapable of caring for herself or singing where she finally was able to acknowledge the extent of her addiction and she allowed her family to have more helpful insight. With the clinical family addiction assessment interview, it would have given information about Edith and tools to help begin the process of um, sobriety and to determine which intervention would be the best for that, as well as this assessment would have created an environment where members could have spoke freely and we were able to establish an understanding throughout the family um, the severity of her addiction, which could have led a quicker result for Edith. So interventions that would be best in this case, we have a couple: motivational interviewing, MI, solution focused therapy, SFT, and competence shaping. I'm going to discuss the interventions as well as the barriers associated with it, just to prevent some confusion. Motivational interviewing can foster the client's own motivations for change through if the counselor provides reflective listening, kind of guides the client with affirmations and allows the patient to guide themselves through their own ideas and goals for quitting. It's all about the client's perspective and the situations that allow the client to make the choices best related for them. It allows the counselors to think and allow the clients to related feel related feel empowered to make their own changes within the therapy. The problem behind MI would be patient resistance. It's really important for individuals to be ready for the change, which it took a very long time for Edith to come to that conclusion herself, due to having being abandoned, people using her and disliking her throughout her life. It would be difficult to earn the child's trust quickly, due to the past relationships Edith had. So, without trust and rapport, the client may be reluctant to share specific parts and hinder the moving forward in the therapy. Solution focused therapy is wonderful at creating goals that allows change for a healthier family dynamic. It focuses forward on the future, allowing families to define their ideal solution. This approach encourages them to envision a life beyond the problem. Uh, Again, barriers with this therapy intervention would be overlooking deep issues and the pressure to find quick solutions. Due to the history that Edith had with addiction, family histories, trauma, there's good chances there were deep rooted conflict that she needs to work through that could potentially have something to do with the addiction and the excessive drinking, the excessive use of drug use. Um, so unresolved problems that shouldn't be overlooked with the car accidents, the tragedies, it would have created deeper issues that needed deeper and longer exploration. And lastly, the competence shaping, another technique used for strengthening and loosening system boundaries and unbalancing systems. So this would be very helpful in acknowledging and reinforcing behaviors and hopefully having those positive behaviors reinforced. So this could be um, a friend of Edith doing something that supports sobriety and acknowledging that, supporting that, that gives the friend um, motivation to continue that habit, as well as give Edith a chance to see what she's doing to help the situation and kind of create a circle system effect, allowing each and everyone to be on the same page and help Edith um, be able to overcome this addiction. The barriers behind competent shaping would be lack of immediate results and inconsistent reinforcement because traveling, she's constantly on the move, having the people that are closer to her around her not be there consistently could be very hindering in the therapy itself, as well as environmental factors due to her line of work. Edith would be exposed to people and situations that can influence an unsupportive relationship or can hinder her progress. So, yes, and let's go to the next slide. So, the barriers. Overall, in Edith's case, a combination of approaches may be most effective. MI can help build trust and readiness for change, while solution focused therapy will guide her to a healthier future once she is prepared to take the step. Competence shaping can further reinforce positive behaviors and strengthen family dynamics. However, due to Edith's history of trauma and environmental influences, progress can take time and consistent support is crucial for long-term success. As far as resources go, here in South Florida, we have a variety of helpful tools, um, services that can help the road to recovery. Um, there is meetings, there's peer groups, we have counseling specifically guided towards women treatment assessments. There is a variety of tools that Martin County can provide to Edith. However, due to her line of work, constant travel, it would have been very helpful for Edith to have a national resource that would have been able to be contacted, utilized 24 hours a day, 300 days a year with information and services for her as well as the entire family. So everyone would have at the touch of their fingers or a phone call the assistant they needed to help guide Edith on her journey. And here we have the citation. Yes. Thank you for listening. I hope each of you get the chance to watch the movie. Very, very wonderful. She was a very wonderful artist. Thank you very much. Have a wonderful day.